I tried drinking excessive alcohol. I'll be open, you know? It's, you know, stimulants versus depressants. I thought, okay, yeah, it's a depressant. Yeah, let me try that. Didn't work. Didn't even budge. And so at this point, you know, the worry spiral starts. And I think, okay, I'm having a heart attack. And so I call the hospital, speak to the charge nurse, and God bless her. She said, you know, it doesn't sound like you're having a heart attack, but we want you to come in for a psych evaluation. And I say God bless her because she was so patient with me on the phone. I mean, I was barely coherent on the phone. I was crying so hard she couldn't understand a lot of what I was saying. So I went to the hospital, spoke to some psychiatrists, some therapists, and they said, you know, basically what you're having is a massive panic attack, and it sounds like this panic attack has kind of been brewing for, you know, the past month. And they prescribed for me some anti-anxiety meds and an aggressive schedule of therapy sessions for the next couple of months, and that really did a world of good. And in the end, with the help of some of these therapists that I was seeing, the university and I were able to reach kind of a compromise. I'm forever grateful to these therapists because they really did step in on my behalf and speak to the dean and say, hey, listen, buddy, this is a person in crisis and you're not helping. The compromise was I was allowed to stop attending classes and I was allowed to stop my lab work, which was really the place where I was the most unhappy. However, the catch was I had to continue being the teaching assistant for the nursing students without pay. That was the deal through the end of the year. And that may seem crazy to you. That may seem like, who would take that deal? Who would take a part-time job when you're living alone on your own as an adult? You know, my parents weren't giving me money anymore. Who would take a part-time job where you're not getting anything? Well, listen, I was, you know, so unhappy. I was willing to accept pretty much any kind of deal just to get away from this place that was so awful for me. And, you know, working with the graduate students, that was the part I liked the best anyway. So they weren't really asking me a lot, I thought. So I still struggle with anxiety today. It's part of my daily life. However, I have learned coping mechanisms. One is medication, the second is therapy, and my favorite is meditation or mindfulness. Okay? Unbeknownst to some of you that may know me, I do a 10 to 20-minute meditation routine every goal day during my planning period. You may have seen the sign on my door. It says, you know, do not knock, do not enter, meditation in progress. It's something that I do. I've found that doing that keeps me more calm during the day. It helps me to more rationally evaluate what's going on around me, more skillfully navigate stressful situations. High blood pressure is a natural side effect of being an anxious person, and when I started doing this meditation routine every other day, there was a marked decrease in the numbers. And you know, you can look it up, okay? You can Google it. There is a plethora of scientific evidence out there that cites the positive effects on the human body of meditation. You know, even if you're a person that isn't anxious and doesn't have to deal with this, it has so many benefits. You should look it up. There's an app. There's really two apps that I like. There's one called Calm, just the word calm. Another is called Simply Being. They're both free. Okay. They're great. You should really check it out. It's Great. I know some of you, your teachers, do a regular routine of mindfulness in your classes, and maybe some of you think, oh, we have to do this. Trust me, it's good for your brains, people. Okay, just suck it up and do it. Okay. So, you know, I agreed to do this talk today, not because I want you guys to hear my story and think, oh, that's so sad. No, I tell you what's happened to me because I'm hoping that these experiences will resonate with at least just one person in this room. You know, maybe somebody in this room can relate to these thoughts and these worries and these emotions that I've gone through. You know, maybe there's somebody in here that knows what true panic really is. And if you are one of those people, I want to say something to you, and I want everybody to listen. Are you all listening? Yes? Okay. Here's what I want to say. If you are feeling this way, you are not alone. Okay? I just read a statistic that said that in your age bracket, 20%, and honestly, in the Northern Virginia area, I would bump that up a bit. Okay? But this statistic said 20% of people in your age group suffer from some kind of anxiety on a regular basis. So for every 5 of you that are sitting there, 1 of you struggles with this. And again, being the Northern Virginia area that we are, I'm going to guess that's more like 2 out of 5. Okay? I can remember one of the most despairing thoughts that I would have when I was, you know, the low of the low times was that I was all by myself and that nobody would understand and there was nobody I could talk to. But I want to tell you that there are people who understand. And there's more out there than you think. You know, and I understand because I have been in your shoes that to a person who has anxiety, me speaking to you, you may not be able to hear what I'm saying. And I get that. But maybe there's a chance that you are hearing me. You know, I would encourage you, if you ever have these thoughts, please, please talk to somebody about it. Talk to your family. Talk to your friends. Talk to your teachers. My own students know that my door is always open. I'm always willing to listen. And even if I don't know you, you can come and talk to me. I will sit with you and listen to what you have to say. Because I've been there. And I am sometimes still there. So thank you very much.